Hey friends, Dr. Christy here, and today I wanted to just talk with you a little bit about fibromyalgia. Now, before I get started, I know and I empathize and I understand fibromyalgia is an incredibly debilitating disease. It's highly inflammatory. It causes so much pain, and I know many patients and friends and family members of mine. I know many people who have this condition, and it's very, very difficult just to get motivated to get up in your day and do normal human life things because you are literally constantly in pain. I understand this. And I wanted to put this video together to give you a couple insights as to what could be going on, what might be some of the root causes of it, and some things that you can help to do, not to necessarily quote unquote cure it, but to help impact yourself with it in a positive way. So number one, fibromyalgia literally means pain of your muscles in your connective tissues. So while it is a real disorder, a real condition, it has become a bit of a what I call garbage diagnosis when medical doctors can't figure out what else is wrong with you. Yes, there are specific pain points that are associated with it. There are specific markers, and if you just come into their office and you have pain all the time, you have pain everywhere, you have this and this and this, and they can't find any other reason, they just say, well, you have fibromyalgia, and that means it's incurable, and that means that there's nothing that they can do to help you. That's not always the case, in my opinion. So first and foremost, you have this pain that's everywhere. To me, that's an inflammatory condition. That essentially means that you have too much inflammation in your body. The question then becomes, why is there too much inflammation in your body? What part of your system is causing issues that it's not able to keep the inflammatory markers under control in your body, that are just letting them go up and up and up and not having them be managed? So I encourage you, first and foremost, is manage inflammation. If you have fibromyalgia, it's critical to manage an appropriate diet. I highly recommend, in individuals with fibromyalgia, I highly recommend almost like a Whole30 diet and adding on the autoimmune protocol on that. If you've never done it, please just check it out. It's a very simple Google search, Whole30 and autoimmune protocol. It involves taking out a lot of things. It's a very strict elimination diet. It involves you going without gluten, wheat, dairy products, soy, corn, sometimes nightshade vegetables as well, eggs, of course, sugar, and I think there's even more things. Yes, it's very restrictive, and then after that point, you can bring certain things back in to see what flares your body. But many times with many individuals with this condition, getting rid of a lot of those foods cuts your pain in half or maybe even more. And then you bring back certain things and you go, oh, I notice now gluten flares me. Then you can be knowledgeable and have that peace of mind, so you know, all right, if I really, really want this piece of cake, I know I'm going to pay for it later. You can then make decisions for yourself based on what you're willing to accept as consequences, so to speak. So first and foremost, check your levels of inflammation of what you're putting in your body. Number two, and this one is really important. Now, I understand that when you have fibromyalgia, you cannot necessarily move and exercise like someone without fibromyalgia would. But that doesn't mean don't move at all. You need to find a very specific balance within yourself and within your body to know what type of exercise and how much exercise is right for you. Because if you don't exercise at all, then you get into that cycle I've mentioned before where you hurt, or you don't move because you hurt, but then you hurt more because you're not moving. Movement is important in the body. It helps keep our joints lubricated. It helps keep things mobile. And when we keep mobile, it actually fires certain nervous system patterns in our body, which feed our brain to have other impulses go back to our muscles in our body and actually does healing. So movement and exercise is important. You just have to be sure that you're not doing too much, and this might be a little bit of a game you play with yourself and you figure out exactly what the appropriate amount and type of exercise is right for you. And lastly, number three, to me, this is the most important. I have not met, and this is not to sound judgmental or I literally have a ton of heartfelt sympathy and I grant grace to anybody dealing with this. And I've never met someone with fibromyalgia that doesn't have some form of emotional trauma in their life, whether currently or in their past. most individuals, there is a strong emotional component when you have fibromyalgia. And that is absolutely not at all to say that the condition's in your head or that you're creating it out of nothing. No, it's a real condition, and it really, really sucks. And our minds and our emotions are so powerful that they can really strongly impact our levels of inflammation. They can impact how our bodies respond to different stimuli. So I highly encourage you, either work with a therapist, work with a coach, work with someone, neuroemotional technique practitioner, somebody who is going to not overlook the importance of trauma and emotional distress and just flat out stress from either a current scenario or past issues that you've ever had in your life, because it absolutely has an impact on your body. That's what I wanted to get out today. If you have any questions, drop them below, and I'm happy to support you in any way I can. Have a good day. Talk to you soon.